Good morning, everybody. Sorry about the couple minutes late start. We had a little technical difficulty that we were working out. This is Tim Carey. I'm the Health and Safety Team leader, and I wanted to welcome everybody to our virtual learning session on the impact of coronavirus disease 19 and the impact on mental health. Our guest speaker is Dr. Cindy Hannawalt. Dr. Hannawalt is a physician, health and wellness director, and COVID employee liaison for Unity Point St. Luke's WorkWell Solutions. She obtained her medical training at the University of Iowa College of Medicine. She is board certified in family medicine with certifications in wound and hyperbaric medicine and DOT medical examinations. She's had graduate training in community health, preventative medicine, and environmental health. After serving the Cedar Rapids community as an independent primary care provider for 18 years, she joined the occupational medicine clinic to further her interest in care delivery, cost containment, injury prevention, stress management, and wellness. She enjoys spending time with family, being outdoors, comedies, and helping others. She and her husband hope to eventually retire in a warmer climate, but until then, she is committed to helping keep the workplace and workers safe. If you have questions during this session, feel free to input them in the Q&A box located up on the right-hand side. You do have the choice to have your name posted with question, or if you like to remain anonymous, there is a box that you can check that will allow that. We will be recording this session, so you will have the ability to re-access it later. We'll send out a link once we have it posted, so you'll have easy access to it. Dr. Hannawalt, I will turn the session over to you at this time.
All right. Can you hear me okay, Tim?
Yes, I can.
All right. Well, good morning, and thank you so much for this opportunity to talk about COVID-19. You know, the last 9 months have been pretty crazy for occupational medicine, and my colleagues and I have been helping businesses and industries, workers, churches, school systems, and individuals, as far as our families and ourselves, navigate this pandemic. And so over the course of today's talk, I'm going to share with you what we've learned about the virus, how the disease is spread, how infections are manifested. And then we're going to focus some of our attention today looking at what the pandemic has done overall for not only our physical health, but our medical health and wellness. So the next few slides. There we go. So we'll start looking at coronavirus disease 2019. You know, despite modern advances in medicine, this new virus took the world by storm. It's caused death and significant emotional, physical, and economic problems around the world. And I have to tell you that I can't help but every once in a while sit back and reflect and say, you know what, why did this happen? Why is it happening? And you know, this virus is new, meaning that none of us have seen it before, so we have no immunity or no personal protection from not getting infected. But then we're learning about the spread of the disease, and this is unlike other pandemics that we've had in that this virus is infecting people, and yet individuals may not have symptoms, and they're able to spread it even without symptoms. We're also seeing this virus, unlike some of the other viruses, is that you can spread it a couple days before you're sick. So it's really hard to try to figure out how do we stop from spreading the virus between our friends and families and our work sites. So as a result, the pandemic has affected really everything that we do. I mean, it affects how we work, how we shop, how we celebrate, how we grieve, and how we care for ourselves and our family. And we'll take a close look at all of these things. So the objectives today are to review what we know about SARS-CoV-2. We'll discuss mental health challenges related to the ongoing coronavirus pandemic. I'm going to present the direct and indirect effects that the pandemic has had on physical and mental health conditions, substance use, and suicidal ideations. Then I will end with highlighting ways to cope with stress in a healthy way, and I'll offer some tips on how we can best support each other and others. So let's look at SARS-CoV-2. So the virus was first identified in December, so we've at a year mark now, first in Wuhan, China. It's a novel virus, meaning that it's new to humans. It's not unlike other viruses. Some of the common colds are caused by coronavirus, but this one's different. It's been more contagious and the spread has been different. It's been coined severe acute respiratory syndrome, coronavirus 2. We did see SARS-1 years ago, and that virus was easily shut down because we were able to get people when they're sick before they could spread it. The SARS virus originally really only lasted from February until July. This pandemic, as we're seeing, is still here and it's still going strong. We had our first case in Iowa back in March, and since then we've been dealing with acute infections, the aftermath, and the mitigation. So let's look at some of the challenges created by the pandemic. I mean, not only from the personal illness, but the psychosocial factors. So morbidity and mortality are terms that we've seen in the news throughout the past year. And the morbidity really is just the process of the disease having on an individual level. The mortality has to do with the fear of death as well as the actual death rates. So looking at morbidity, what we're seeing from the pandemic are both short and long-term effects of the illness. This causes our physical changes, and the physical changes can lead to some psychological stressors, but we also find with this virus, we are seeing some psychological distress. This includes how we cope with the acute infections and how people are continuing to live with lingering symptoms. And we are seeing symptoms that persist weeks after the initial recovery. And we're also having to cope with the loss of loved ones. I mean, this has been unexpected in many ways, and the magnitude of deaths that we're seeing across the nation has been very difficult. The social disruption caused by mitigation activities have caused separate problems. It can help us stop the spread of disease for sure, but it's leading to loneliness, and it's impacted how we can access services, which can also cause difficulties in caring for underlying medical problems. We're also seeing how the inconsistent messages from public leaders has created some insecurities. We've learned that the continuous reporting about bad news in social media has led to continued fear and anxiety. And we have a general uncertainty about the future. So not knowing when this pandemic is going to end, how it's going to end, and how it's going to cause our lives to change creates a sense of vulnerability among many of us. So let's start with looking at the individual health and well-being that COVID-19, the infection itself, has been causing. Most of us have learned by now all of the symptoms of COVID-19. We know that some symptoms are more prevalent than others, and some people have very non-specific or even no symptoms when they get infected. Other individuals are at risk for having severe illness, and we're starting to see now the lingering symptoms afterwards. But the bottom line with why this impacts us so much from a mental health perspective is that when individuals are sick, and we know it can be transferred to somebody and make them very sick and even cause death, that we've had to isolate. It's a self-isolation, it's the quarantine that occurs after you've been exposed that is leading to a lot of the mental illness that we're seeing. We're also noticing the social stigma associated with this virus. And the social stigma really is what happens when individuals are discriminated against because they have a particular condition. And sometimes it's even discrimination against individuals from a particular region. And so we've seen that early on with this virus, that we're blaming people from China, we're blaming individuals because of our own fear and our disappointment of what this virus is doing to us individually and as a nation. So I'm going to switch now to looking at some of the long-term physical and mental health symptoms. So after the acute infection, so I mean, people, when they are infected with COVID, like I said, it can be mild or they can be pretty sick. I mean, they can have pneumonia and shortness of breath, along with resistant fevers, dehydration, leading to some kidney problems. But then after that recovery phase, we've learned about after 10 days for individuals that are generally healthy, they're probably no longer contagious. That doesn't necessarily mean that they're back to their baseline or they're feeling 100%. So some of the lingering symptoms that we're seeing now is fatigue, and that's probably been number one. The chronic fatigue associated with this disease has been pretty overwhelming, and that does make it difficult to return to work and your normal activities. We're seeing ongoing headaches, muscle pain, breathing issues because of the scarring in our lung tissue. And what's been noted among a lot of people trying to return to baseline is that brain fog, just difficulties with concentrating, as well as with mood changes. We're also seeing some cardiac issues occurring, increased susceptibility to heart attacks and just some heart arrhythmias. And we're still seeing some intermittent fevers, not necessarily associated with still being infected, but just the complications after the infection. But we're also seeing data on individuals that have been diagnosed with COVID-19 about psychiatric diagnosis. One study in the Journal of Lancet Psychiatry showed that a couple weeks to 3 months after the diagnosis, that mental health diagnoses were increased by 18%. The most common diagnoses associated with these infections were anxiety, depression, insomnia, inability to sleep, disrupted sleep pattern, post-traumatic stress disorder, and dementia, or cognitive impairment. We're also seeing that people with pre-existing psychiatric illness also have worsening disease. That doesn't mean that if you have a pre-existing diagnosis that you're more likely to get infected, because we know everyone can be infected. But because of circumstances around individuals with certain illnesses, in particular psychiatric illness, their living situations, their access to healthcare, all of those things contribute to their worsening profile. And we've also learned that a history of psychiatric diagnosis is associated with a higher incidence of COVID-19. So let's look at the indirect impact of COVID-19 on mental health. So this pandemic has caused excessive worry, fear, and stress. Fear of getting sick has kept people from going to the doctor, and by virtue of that, they're not getting their treatments for their diabetes. We're not getting treatments in a timely manner for their cancer and other underlying health problems, which sets them up for having more severe illnesses. People are fear of getting sick, and they feel anxious about not being able to take care of their family, and they're fearful of losing their job if they can't work. We've seen loss of childcare and school closures, which affects our work schedules and disrupts even our ability to work from home. And we're also seeing some mental health impact of our children, particularly our teens. And we've seen increased stress in the home associated with domestic violence and child abuse. So all of this leads to an impact on us psychologically. And psychological distress can lead to poor sleep, difficulty concentrating, overeating, eating poorly, increased use of tobacco, alcohol, and other substances. We also see psychological distress can lead to work absenteeism and decreased productivity. And we've seen how psychological distress can create an acute stress reaction, and this reaction causes both physical and emotional symptoms. I mean, these are feelings of panic, a racing heart rate, a sense of doom, excessive crying, and alternatively just apathy. We're seeing increased headaches and the shortness of breath, mood irritability, and physical symptoms of nausea and stomach upset, and really just a general feeling of unwell. So panel surveys obtained on adults over the age of 18 across the United States in 1 month. So we looked for the month of June, and they sent out a survey, and it showed increased anxiety, depression, and post-traumatic symptoms, as well as an increase in substance use and consideration to committing suicide in the United States. So that the numbers are there to your left, that 31% of individuals reported anxiety and depression. So in general, at any time in the United States, adults may report up to 18% symptoms of anxiety and depression. And I wanted to focus a little bit about this consideration to suicide. If we look at the percentage of individuals who were seriously considering suicide in this survey, the majority of them were between the ages of 18 to 24 years of age. We had a higher likelihood from our minority, racial, ethnic groups. And we've also saw increased self-reported unpaid caregivers having stronger consideration. And that just tells you how overwhelming the changes from the pandemic has on us personally. And we're also seeing an increased thought of suicide from our essential workers, those individuals that have worker overload, and are also seeing some of the devastation associated with the pandemic. We're also seeing this across other countries. There was an article recently about Japan, and it was either October or November. Japan reported more deaths from suicide in that 1 month than the entire year from COVID-19 infections. So let's look at post-COVID stress disorder. In October, Psychiatric Times also reported another emergent consequence of the global pandemic, and this was traumatic. We're seeing traumatic exposures from the pandemic that are qualifying for criteria of a diagnosis of PTSD. We know that individuals suffer serious consequences from the illness, and I really can't stress enough about the illness. Individuals who, fortunately, it's a small percentage of individuals that have the infection and have severe illness, but once individuals are hospitalized and have to be placed on ventilators, it's a very traumatic experience, and it takes a while to recover, and some are not recovering at all. And we're also seeing individuals that have witnessed others suffering, and and a lot of the hospitalizations because of the transmission of COVID, they're being hospitalized alone, so we can't be with our loved ones when they're suffering, to be there to support them. And then the grieving process, we haven't been able to have funerals or to pay tribute to those we love, and so all of that is contributing to increased stressors. And we're seeing extreme exposure to bad news. And, there's been a lot of terms out there with this pandemic that has been coined specifically for the pandemic, and doom scrolling is one of them. And that's really just receiving an overload of bad information every single day. That's hard for us to maintain a positive and a hopeful attitude, and not knowing when things are going to get better, or even having the skill sets to make them better. So let's look at some of the populations at risk. For psychological stress, we found that people who are also at risk from getting severe disease from COVID-19, so these are the individuals likely to be hospitalized and need ICU stay. Those are individuals with baseline heart and lung disease, diabetes, chronic kidney disease, and cancer. But we're also seeing increased psychological stress in our children and teens. These individuals' worlds are disrupted, and we're having to try to figure out a new normal on how to keep our kids engaged through school. Individuals not having access to their peers leads to isolation. And I've had parents tell me that their kids are worried about having the other kids not like them, or if they'll be remembered by their friends and their teachers. We're seeing the overload of psychological stress on our caregivers, our frontline and essential workers, as we talked about. This also includes our police as well as our factory workers. And we're seeing people with pre-existing mental health conditions and poor social support really not faring very well. If you didn't have a good framework for coping for crises and life problems before the pandemic, all of that has just gotten worse. Obesity has been identified as a risk factor. In general, obesity tends to have a host of medical problems associated with having too much adipose tissue, but there's also a lot of social stigma associated with obesity, and individuals tend to decrease access to care and delay getting the care they need. And we're seeing large overconsumption of alcohol, which not only impairs our immunity, but causes other psychosocial problems. I spent a little bit of time talking about alcohol consumption. So changes in alcohol consumption has been noted during the pandemic to increase over 14% from baseline. Our alcohol sales are up, our use patterns are up. We're seeing increased use, women more so than men, but in general, the use is escalating. And again, it's one of those coping mechanisms. The downside of using alcohol is the central nervous system depression. So it really doesn't make us feel better. It's kind of numbing, and it helps us escape a little bit, but it doesn't provide opportunities for good coping mechanisms. Excessive alcohol intake can lead to worsening mental health problems because of that, but also physical problems such as high blood pressure, liver disease, stomach ulcers, among others. The isolation associated with the pandemic has also had a significant impact on young and old. Our lockdown policies have created significant social isolation, particularly with our nursing home residents. And by isolation, we're seeing more depression, anxiety, we're seeing worsening dementia in some subgroups. And all of this is impacting not only of our quality of life, but we're also seeing a decreased life expectancy in our older adults. There's been a term coined Blur's Day, which meaning the merging of minutes and hours and days that impact all of us because our days have less variety in them, and that's leading to loss of time and daytime confusion. Interventions to help alleviate this include arranging new activities and looking at alternative activities like pet therapy and other creative ways to connect with friends and family, and trying to make sure that everybody has access to social media. So factors influencing mental health and well-being, we have a host of protective factors, and number one is that social support. So individuals that were isolated before the pandemic, that has definitely gotten worse. So we need to look at strategies how to reach out to individuals, especially with our church closures. We found some adults that was their main frame of social interaction, and so now having new opportunities and task force set up to be able to help alleviate some of that burden. Taking care of ourselves. It's hard enough on a good day to take care of ourselves, to make time to exercise and to try to eat right. And now having to do that under new circumstances with our gyms closing and now having children at home. Financial stability and employment helps protect us when we're not worried about financially paying our bills, and if we do have a change in our financial status, being able to reach out to avenues for support. We know that regular health checkups are important. Getting your flu shot, maintaining all your immunizations during this time can help protect us. Having a safe workplace and having adequate PPE is important for our own protection and our own psychological well-being. And then having a psychological sense of resilience. And I'm going to spend some time talking about that. So psychological resilience looks at really our ability to cope. Having a good self-awareness, meaning being able to take an honest look at your life without attaching judgment. It is what it is, and where do we go from here? Having a sense of mindfulness, giving yourself grace. It's okay to feel what you're feeling, and avoid that all or nothing thinking, saying if I can't do this, then I can't do anything. And so it really is looking at the continuum of where we're at and where we want to go. It's practicing those good self-care techniques, eating well, exercising, getting the rest you need, and avoiding bad habits. It's developing and maintaining positive relationships and learning how to interact in new and different ways. So just because we're afraid of getting a loved one sick doesn't mean we can't communicate with that loved one. And finally, just maintaining that purpose, not losing sight of living. And it means we have to readjust goals. And it may be we don't feel well enough to clean our whole house at one time, but that doesn't mean not doing any of it. It doesn't mean not having a normal day-to-day expectation and a belief in the tomorrows. So let's switch gears as we wrap things up here about healthy ways to cope with stress. One is getting the facts. We know the more you understand about the disease, the better you're able to protect yourself and not be so fearful of it. Taking breaks from watching all the gloom and doom and spending time learning new things. It means practicing healthy lifestyle behaviors and helping others do the same. Talking to others about how they're impacting and being able to problem solve and being able to help each other out. Taking that moment just to reflect about your day and where you're going and finding the good in the things that you're doing. And then utilize online resources and other ways to be in touch with yourself, as well as getting the help that you need from the community and your loved ones. So let's look at some tips for helping others. I mean, as simple as it may sound, it really is just asking each other how you are, being honest with yourself, how you're feeling, and being able to connect with others. It's being nice and respectful and non-judgmental. It's being able to offer help to individuals the way that you would if somebody had cancer or somebody had some other diagnosis. It's being able to ask how you're surviving the pandemic, as well as how are you dealing emotionally, and not shying away from hard topics and keeping the conversation going. It's not asking, finding out somebody's struggling, and then not knowing how to continue to offer assistance. So tips for talking to people with mental illness. I thought this was important because a lot of times I think we avoid from asking people emotional type of questions because we just don't know how to handle it. So here's some of the things we should say. When somebody's struggling, just asking them, do you want to talk about it? And when they are talking about it, thank them for opening up. And it doesn't mean you have to be the problem solver. It doesn't mean that you have to have solutions. It just means that you have a willingness to understand and that you care. Asking individuals how you can help. That doesn't mean you have to have the answers, but individuals like to feel supported, and support is achieved when you're willing to ask. letting people know that you're sorry to hear that they're struggling with it and that you're there for them. And then asking them how you can help, find them help, and even take them to an appointment. And then just following up about how they're feeling. What we don't necessarily think is good for people to say, and I understand as a parent, there's times when I want to tell my kids to snap out of it, or, you know, it could be worse, it could be all of these things, but really when talking to somebody with a mental illness, those are things that we should stay away from, saying that it could be worse, telling them to snap out of it, to pull up their bootstraps, or that everyone feels this way sometimes, that we've all been there. Put yourself together, asking what's wrong with you. Try to think happy thoughts. It's really about adding that support and not making them feel like it's their fault that they're feeling like they're feeling. I've included here some resources for individuals that are contemplating suicide, dealing with substance abuse, as well as smoking cessation. If anybody is smoking now, this is a really good time to stop for a variety of reasons. And those offices are available through websites as well as telephone. I've included some resources where I've gotten the materials today. Just to look further into some of the information, the CDC, OSHA, those are good websites, as well as Iowa, the Healthiest State is a new programming that has been reaching out to help people talk about mental illnesses. I'm going to go ahead and end here my talk, and I just, you know, if I can underscore anything today, is that wellness includes a peace of mind. It really is an active process of becoming aware of and making choices towards a healthy and fulfilling life. And I really do hope all of you the very best. And I want to give you the support and the strength not to let this pandemic fatigue that has taken over all of us. I know we don't want to wear masks. I know we don't want to stop gathering. We don't want to have the celebrations, but the pandemic is not over. We are working every day towards advances in treatments. We're getting vaccines very soon, but that doesn't mean we can stop doing what we're doing. The only way we can help shut this virus down is to stop it from having a host. If no one gets infected, we can't spread it to other people. So on that, I'll go ahead and exit. My email is there for your reference, and I can take any questions.
Well, Dr. Hannah, thank you very much for that interesting, important information that you just presented to us today. We are open for questions, so if you have any questions, please feel free to post them. We did have one question we had earlier for you. Do you have any suggestions for the fatigue that goes along with this, and how it kind of works with the complacency, you know, with the items that were being asked, where you just mentioned the mask, but, you know, to lower the chances of us getting that? We're seeing a lot of the fatigue in different places.
Sure. You know, and that's been the big, not only from the original infection to the aftermath, is really hydration. In general, we do not drink enough. And that's what we found to keep people out of the hospital and to help with our tissue recovery. So drinking 8 glasses of water a day, avoiding caffeine, avoiding other stimulants, because it's really counterproductive for our healing. Making sure you're getting adequate sleep and rest, and not pushing through things. I mean, when we're sick, we lose a lot of muscle mass and stamina. And so building back into that slowly, and the grace that I talked about is like, when you start to fatigue, you need to rest. You need to step back and take those moments to regroup and then go forward, and giving yourself some time.
Okay, I see another question here. How do we be mindful that when I just lost the question.
See if I can find it.
Yes, how do we be mindful that when the normal happens again, we might have challenges getting back to that?
Can you repeat the second part? When the what happens again?
So when we get back to normal again, we might have challenges actually getting back to that mentally, even though if we have the vaccination and we're through the hard part of this in the future, what challenges do you see getting us back to a normal thing with the apprehension that people have?
Some of it is that excessive worry and fear, and being able to frame that in a positive perspective. And I'm not sure what normal is going to mean. This has changed our baseline, certainly from what we've seen in the past and where we're going. And so I think that just making sure that the whole hygiene spectrum, the physical distancing, and just, making sure that we gather in situations that we're apart. But I also think we're getting smarter. We're looking at ventilation now. We're looking at turnovers and air quality, and scheduling those things. So I don't know if I'm giving you a great answer to it, but I think we just have to continue doing what we're doing and being smart about how we're doing it.
Okay. I see one other one here. I hear people say when 2020 is over, but things will not change with the new year. What is a better
Am I still on?
Yes, you are. I think it might have frozen for Tim. I'll go ahead and read that question.
Okay, thank you.
Yep. When I hear people say when 2020 is over, but things will not change with the new year, what is a better way to look towards making it through the new term?
Right. So I'm very optimistic that next year at this time it's going to look better. And I just had this conversation with my 2 college kids last night, is that spring semester we're probably still going to be online with it, and everybody's kind of gotten their pod and who they can hang out with. We're going to see some travel open up because we know now about transmission and wearing a mask and all those things we can do. I think next fall we're going to have at least our college students back in most of our universities. And as we look through this new normal, and in my head, I think by July, we'll be able to have some of the vaccination process in place. It doesn't mean that it's going to go from getting a vaccine to not needing to still mask when we're around others in public. Some of these things we just need to keep on our top shelf going forward. And we're hopefully going to see less of an influenza season this year because of the fact we are masking and distancing, and the way that we spread other germs, so to speak, will be better with this. And it doesn't mean that we can't go to sporting events. And I think there's going to be ways that we can set up ways to congregate again that is going to be much safer. And we're getting better at testing. As we have more testing capabilities, we will be able to identify individuals that are infectious, not only to keep them away from others during the time, but to allow other groups to continue to congregate.
Well, hopefully you can hear me again. We had another question here. I've had to find a mental health professional for a family member, and most practitioners were not taking new patients or available appointments for months out. What are some of the other outlets to help people who are feeling depression or anxiety, to hold them over until they can get in and see a professional therapist?
So, knowledge is power. And so the resources that I gave you, so reaching out to those organizations, one, to make sure that you have the information you need to be able to discern, is this person safe, alone, safe at home, and what things you can be doing to help enhance their recovery from the mental illness. And as far as seeking acute treatments, talking to the crisis line is very helpful. Looking at avenues for assistance. If you can't see a psychiatrist, if you can't get into your primary care provider, there are other ways to be able to connect with individuals who have training in this area. And not everybody sort of wants a religious path, but there are some spiritual leaders that can be helpful. And just asking individuals, counselors, and I know payment is the issue. A lot of them, though, are working on a sliding scale, as well as being able to have an appointment virtually, and we're getting better at that as well. But making sure if there's a critical situation, if you reach out to a primary care provider, they can help plug you into the right resources.
Okay. Do you have time for a couple more questions?
Yeah, I'm good.
Okay. This question comes in. One of the things I found difficult at times is dealing with the social stigma of doing what I feel is right. Mask wearing, distancing, etc. I feel a lot of people in my small community view it as an overreaction or being paranoid. Any advice on how to address that?
Well, one, I want to acknowledge how hard that is, and I really am sorry to hear that. I find the same thing going out in public. I went to rural Iowa this summer, and my mom's home on oxygen, and so I take this very seriously from a lot of fronts. But I walked into a gas station and I was ridiculed because I had my mask on, and it's moments like that that we really have to square our shoulders and know that we're doing the right thing for the right purpose, and continue to be that role model for individuals who are not, and taking those opportunities to do the right thing, though not easy, are important. And we're learning now that there are some repercussions. I had a friend just tell me this morning that, she watched her pizza being made by workers that weren't wearing a mask. And, you can report those institutions not following guidelines for mitigation. And, even, talking to individuals to recognize OSHA is watching this very closely too, that when you have business and industry that is not following mitigation advice to protect their workers, that's reportable. And so there are going to be consequences. And I always hate to rule by sort of the stick. I'd rather have the carrot and say, you know what, let's all do the right thing so we can stop wearing masks sooner. We can get our lives back to normal. But I think the best advice I have for you is that, go to bed every night and know that you are doing the right thing and you are making a difference for public health, and being able to spread that sense of culture, inclusiveness of saying everybody matters. And we're doing this not because I probably am going to get that sick, but because I don't want my children or the elderly or the other vulnerables to have a negative outcome.
The last question that we'll ask, we had a question for those of us who suffer from depression and anxiety, and we're using the gym to keep ourselves active. What advice do you have to keep the motivation up, to keep that exercise going when the gyms, are no longer a safe space, or they feel that they're no longer safe to go into?
So, I let my membership go too when this hit. I thought, you know what, I just can't be in a closed space with potential virus being on equipment that I'll be using. And so it's still making time at home, and I did go buy a little pair of hand weights. There are a lot. Netflix has quite a few. There's a lot of streaming that you can get, but it's making that part of your calendar. If you used to go to the gym at 5 a.m., then get up at home. And, even calisthenics and some of the things that you can do inside when it gets too cold to be outside, but keeping that schedule. And you know what, we can really do a lot with just a good pair of shoes and our own body. So push-ups and sit-ups and all the stuff that we hated in physical education, they're still good for us. But I do want to point out, as we get back to normal, the gyms are also getting better. They have better sanitation. Now that we understand what disinfection agents are needed, we know how to space things. We know that everybody's going to be mindful about wiping things off after they're using it. And you know what? You can work out with a mask on. That, everybody thinks, well, I can't, I have a mask. The mask in general, if you think about it, what our firefighters do when they go out and work and the protection that they have, that's really hard to breathe in those. But in general, the 2 to 3 ply cloths mask, you can still work out in that. So don't write all of the gym experiences off, because some of them are doing a really good job.
Well, I want to thank you again for your time. We did have one statement come through the question and answers. Thank you for your leadership and reiteration that doing the right thing for the right purpose is okay, and we appreciate your time today. So we really appreciate you coming on.
You're welcome. And Tim, I had sent you my slides. I actually saw some typos in there, so I'll send you a new version. I think something came up about whether they can get a printout. So I'll send that to you, and you're welcome to distribute it.
Okay. Well, thank you very much, and thanks everybody for joining us today.
You bet. Stay well. Thank you so much, everyone.
Thank you, Cindy.
Thank you.